Okay. Good morning, everybody. My name is Nancy DeLauro. I'm a nurse currently with SUNY Sullivan College. I'm working with students, but previously my experience with Medicare and Medicaid insurances was through the health department of Orange County. I worked with them for over 25 years as a public health nurse and became familiar with Medicare and Medicaid because that's how we build our patients' services that we provided. However, I have to say that that was 4 years ago. Things have changed so much rapidly. And I did a lot of research and was blessed to find Eleanor Minsky through the Ulster County Office of the Aging, who is a Medicare specialist and who is going to answer a lot of the questions that I have read about from and have heard about from other people. So I'm going to start asking some questions of you, Eleanor, if you'd like to introduce yourself first before we begin.
Yes, thank you so much, Nancy, for inviting me today to speak to the people out there who are interested in getting some independent information about Medicare. Right about now is open enrollment from October 15th to December 7th, and people's mailboxes are getting stuffed with all kinds of mail, and they read it and they don't know what's what. Well, a lot of those are from salespeople. So
Right.
at the Office for the Aging, we don't sell any insurance. We just give independent information about what's out there, and we help people on a one-to-one basis, if they prefer, in a 1-hour appointment to find the best plan for them. And by doing that, we go on the Medicare.gov website, which is the official federal website, to get them the information they need about all the plans that are available in Ulster County. My background is that I have been with the Office for the Aging as a certified Medicare counselor for about 9 years. And my job is to do outreach. So I do this all the time. I give presentations, and I am available to speak to groups, to do Zoom meetings with groups, to give the information about Medicare and about the Medicare Savings Program, which will come into being when you and I talk and we get more into the nitty-gritty of what is Medicare. But as a certified counselor, I have trainings twice a year. We get trainings for statewide for all of the counselors. And so, as you said, it's been changing quite a bit in recent years, and we get the updates twice a year.
Okay, so that's a good segue to begin by. If you could just give us a idea of what original Medicare is and how is eligibility determined?
Eligibility is determined by age. When you reach age 65, or if you are disabled and you've had Social Security disability, then you become eligible for Medicaid. So Social Security disability is any age. If it's Medicare, regular, original Medicare, you have to be 65.
Okay. Are there some exceptions to receiving Medicare, though? I understand if someone, say, has end-stage renal disease, they would be able to be eligible for the Medicare.
Yes. There are all kinds of rules like that. And those kinds of questions are better answered in a one-on-one appointment basis because they have so many nuances to them. We get special trainings just for end-stage renal. And so that is something that in an overview, we wouldn't really go into depth about. But the other thing that I want to say just briefly, because this is another area that's very specific and has a lot of Pt1 rules and regulations, is how it works. If your birthday is in December, then you count back 3 months, and that's when you start the whole process for Medicare. So 3 months before, the month of your birthday, and then 3 months after. That's your initial enrollment period when you can enroll. And I always urge people to begin 3 months before, because it may take that long. The Medicare
Right.
will start on the first day of your birthday month.
Right. So could you break down Medicare Parts A and Part B for us?
Absolutely. And I have supplied this handy dandy chart, which helps explain Medicare. And you can see that it's 2 lines. And this is what confuses most people. They don't understand that Medicare is 2 systems, and they work separately, but they're both Medicare. I will now go into original Medicare, Part A and Part B. There you see the chart full. Part A is your hospitalization. Going into the hospital, what happens? You have to pay a deductible. The deductible this year is $1,484 when you go into the hospital. That's a sizable deductible. Then your Medicare Part A will kick in for your hospitalization. It will pay 80%. And then you have to pay 20%. For Part B, that's everything else. That's your doctors, your x-rays, your blood tests, physical therapy, everything else. That is a $203 deductible at the beginning of the year. So you pay out of pocket, out of pocket, out of pocket until you reach the $203. And then Medicare will pick up 80% and you pay the 20%. Now, let me say one other thing about Part A and Part B. For most people, Part A is free in terms of an extra premium that you pay to Medicare itself. Part A, free. Part B, however, has a $148.50 fee. It's really a fee. It's not insurance. It's just something that all of us who are on Medicare have to pay right off the top of our Social Security.
So excuse me for interrupting for a moment.
Go ahead.
Just to clarify,
Yes.
that is taken out of people's Social Security, or are they billed for that?
If they are getting Social Security, it comes right off the top. If they are not getting Social Security, because some people, when they reach age 65, are still working and they don't, they don't get Social Security. Well, then the government's going to get their fee. So they
Right.
will send them a bill for 3 months worth of this payment. So $148.50 for 3 months. And of course, Nancy, like everything else, it goes up every year. And the word that we're getting is that next year, 2022, it will go up to $158. So about a $10 increase for next
Right.
year. And of course, all of the other numbers that I'm mentioning will go up as well, but we don't know yet exactly how much.
So The next question I have is regarding covering that 20%.
Yes.
Would be interest in Medicare Part C, if you could explain that in detail.
Okay, let's not get mixed up with the ABCs. Okay, and that's something that everybody gets mixed up on. We've looked at Part A, we've looked at Part B. We aren't going to talk about Part C. Why? Because Part C is that totally different column. The Medicare Advantage plan, that's Part C. That's a totally different type of plan. So forget C for now, but let's look at Part D. D as in dog. That's your prescription drug coverage. On this side, the original Medicare side, that is a separate freestanding prescription drug program. And there are about 4 or 5 companies in Ulster County that provide prescription drug coverage. Each company has 3 or 4 different kinds of plans. And we can look at those for Part D, prescription drug coverage, separate for your drugs. Then you go down to supplemental or Medigap. And that covers what you were saying. That is how the 20% is covered. And also sometimes that deductible that I talked about in Part A is covered. That $203 Part B, sometimes that's covered by your supplemental policies. Now, one thing I can say about this whole side that we've looked at, original Medicare Part A and B, Part D, your prescription drugs, and your Medicare supplemental Medigap policies. The one good thing, really good thing about this side is when you have this, you can go to any doctor, any hospital, anywhere in the USA. And that's
But that
very
doctor,
important. Yes.
excuse me, Eleanor, but wouldn't that doctor have to accept Medicare and
Absolutely.
reimbursement?
Absolutely. That, of course, is a given. The doctor would have to accept Medicare. If the doctor doesn't accept Medicare, well, that's like a whole different kind of issue. And we run into that sometimes. And people say to me, well, I'll always know if my doctor accepts Medicare, won't I? And I say, okay, you're in the operating room. You're under anesthesia. You're out like a light. You don't know anything. Some doctor comes in and he or she does something. Who knows what, but something. A couple of months later, you get a bill. You say, who is this? I don't know this person. And that's the doctor that did something when you were under the anesthesia. That doctor did not accept Medicare, so you're getting this separate bill. That's how that happens, but it's very rare, but it's something that I have to mention to people.
Okay. Does Medicare Part A cover any prescription medications?
It only covers what you get in the hospital.
Okay.
But I do want, before we leave this side, Nancy, I do want to tell people how they can get back that $148.50 that we have talked about, which we pay, because even when we get over to the other side, that other column, and we talk about Part C, the Medicare Advantage plan, same thing. Everybody has to pay that $148.50.
Right.
Unless they're financially eligible to get it back. And that's the system they have now. You can get that $148.50 back. You pay it out, comes right off the top of your Social Security. Some people can get it back. Who are those people? These are people who are financially eligible. And I'm going to say this really slowly so you'll understand it. That is your monthly income gross of $1,469 if you're a single person. So a single person gets Social Security, maybe a small retirement amount, whatever it is, it comes to $1,469. If you make less than that on a monthly basis, you are eligible to get back the $148.50. If you are a couple, it's $1,980 for the income of the household. And that's gross income. So the money you get in your Social Security, they've already taken out that $148.50. So in order to see what the gross is, we have to add that back in to get the gross amount. $1,469 single, $1,980 couple. Now you say, oh my gosh, Eleanor, that is such a small amount. And I say, well, Nancy, there is something that we can do. And that is we can look at the medical insurance premium that the person is paying, not the drug insurance part, the medical for your doctors. And all of that we talked about as being medical. If you have a premium for that, you can deduct that from your income and possibly come down to the $1,469. So that's what it takes an expert like the people at the Office for the Aging. We do that math and we figure out if the person is eligible by being able to deduct their medical premiums. And you know, when we're talking about a policy, a drug plan like the one that's a supplemental Medigap one, we can be quite high in the monthly premiums because it's going to cover so much. You take a premium for the type of plan that's going to pay the entire deductible when you go into the hospital, plus the entire 20% that Medicare doesn't pay, then that's going to run some money. And monthly, it does run some money. For the cheapest plan F, right now, we have two plans that are, and these are the premiums in effect as of September 1st, 2021. So it will go over into 2022. We have plans that are as cheap as $312 a month, $243.80, $267.50. Now, you say, well, how do I know what that covers? And this is another complicated discussion, but this has to be talked about because it's so different than the way the Medicare Advantage plans work. When you are on this side and you're looking at a supplemental policy, what you need to know is, by law, every company that offers a supplemental policy must offer the exact same coverage for its plans. Yes, they have different plans. There's Plan A, Plan B, Plan D, Plan F, Plan G, Plan N. All of the companies must offer the same exact benefits, but
And
they're
that's
allowed to.
that is federally regulated.
That is regulated. That is regulated by either the state. I think it's the state, Nancy. It's the state that regulates it through the state insurance.
Okay.
And as I mentioned, It runs all across the board in terms of what these companies charge for the same exact premium. So therefore, at the Office for the Aging, which ones are we going to recommend? If every company is offering the same exact benefits, we'll recommend the cheapest ones. And we do. So the cheapest ones are the Empire Health at $243.80 for Plan F, and the United Healthcare AARP, which most people know about, and this year $267.50. And that's your Cadillac plan from soup to nuts. I'll give you an example. I went to California to visit my son and his family. I fell. I broke my wrist. I had to go to the emergency room. $30,000 later.
Wow.
Okay. How much did I pay because I have Plan F and original Medicare? Zero. Nothing. Zero. Because I have this Cadillac plan. So I didn't have to pay when I went into the hospital or the emergency room. Zero. And then they picked up this plan. My AARP plan picked up 100% of the remaining bills. So it's very powerful when you're on this side. And the other thing I wanted to mention before I let this slip by, when we were talking about the Medicare savings plan, that one that gives you back the $148.50.
Yes.
In addition, when you get on the MSP plan, we call it MSP short, so we don't have to keep saying Medicare Savings Program, the MSP program, you also automatically become eligible for what's called extra help.
That
What is
was my
extra
next question.
Yeah.
That was my next question. Can you go into a little more detail about extra help?
Extra help is going to be placed right in that little box with your Part D prescription drug coverage. That is help for people on their prescription drug coverage. How does it help? It will pay your drug premium, your insurance drug premium, up to what's called a benchmark amount, which next year will be around $35. So they have certain benchmark actual policies that are offered. There's about 4 companies that offer them, and their premiums are under the $34, $35 range, so that your entire premium is picked up. In addition, your generic drugs, your everyday drugs, $1 or $2 for your copay. But here's where it really makes a difference. For your expensive drugs, your insulin, your inhalers, all of those expensive diabetes drugs, any expensive drug, tier 4 or 5, $7 or $8. People's eyes should be widening now and saying, really? How do I get this? Well, as I talked to you just a while ago, you have to have an income of less than $1,469 or $1,980, and then you are eligible to get those benefits.
Okay. Can we return for a moment to Part C Medicare?
We're ready now to go over to Part C. Part C is known as the Medicare Advantage Plan. And people are getting their mailboxes stuffed, as I said. And in addition to that, because this is open enrollment time, in addition to that, don't get me started on this, Nancy. There are all of these advertisements on TV now, from Joe
Honestly.
Namath on down. talking about all these benefits that people are going to get. Well, as you know, right now, original Medicare does not pay for what? Eyeglasses, hearing aids, or
Dental. Right.
dental, the biggie, zero. They're trying to get it through, but doesn't look good from the latest, what we hear. It doesn't look good that it's going to go through right now. If you're on original Medicare and you're on the left-hand side, then that is not covered. You go over to Part C, Medicare Advantage plans. On these advertisements, it makes it sound like, oh, you'll get everything. You'll get dental, you'll get eyeglasses. Every plan is different. And what we find is the dental plans, they're there if you pay an extra premium, but they're not robust. Let's put it that way. They require you to pay a certain percentage of the dental bill, and that can be quite high in terms of the dollar amount if you're having something serious like a root canal done or something of that nature. So you have to be very careful and go over the fine print very carefully in terms of what you are going to get if you look into these separate things, the dental and the eyeglasses and the hearing. And in terms of everything else, lots of co-pays, lots of deductibles. And I tell people where the rubber meets the road is in hospitalization. Hospitalization. That is where you will find some very big co-pays. You go to one of these places that are insurance, they're nothing but insurance sales meetings. They entice the seniors by saying, we give refreshments, we'll give you a meal. So you go there, and I've been there to hear what the salespeople say. They gloss right over this.
Mm-hmm.
Hospitalization, what is that? Oh, that's $365. And then they move right along. $425, $285. What are they talking about? They're talking about $385 per day. For how many days? It depends. It could be for 3 days, for 4 days, for 5 days. So if you're in the hospital for any length of time and you're paying $385 per day for 5 days, do the math. That can be quite extensive.
Right.
Where the rubber meets the road. And then if you have to go into rehab, oh my gosh. You're at a special facility. Medicare will pay the first 20 days. What happens after that? You're going to get a copay, and a big one, unless you're on original Medicare and the other side.
So it's original Medicare versus the Part C.
Yes. And let me give you this instance, which happened to me. And this will give you, in a nutshell, how the whole thing works and how you can have some strategy. Because, you know, Nancy, people call me up and they say, well, what should I do? Which should I take? Should I take the Advantage plan? Should I take the original Medicare plan? But those premiums are awfully high. You know, they run across the board too, depending on how much coverage you're going to get. But they can be a lot higher than the Medicare Advantage plans, which some of them have a 0 premium. Okay, so I say, look, it's 2 factors. 2, your financial situation and your medical situation. If you're somebody that tells me that you've had cancer, you've had open heart surgery, you have serious diabetes, you have kidney issues that you may have to go on to dialysis at some point, then I say to you, you know something, you're going to have to look at the original Medicare and the supplemental side. Okay. But you're not. You say to me, no, Eleanor, I'm not like that. I only take one drug and I'm fairly healthy. I go to the gym, you know, I'm fine. I say, okay, here's the story I'm going to tell you. I had a Medicare Advantage plan when I started out. This was about, I don't know, 5 or 6 years ago. And we had CDPHP here in Ulster County, and it was a pretty good company. It has since pulled out of Ulster County. We don't have it anymore, but that's what I had at that time. And I was pretty happy with it. I went over to Turkey for a 3-week vacation. Loved it, had a great time, came back, flew on Turkish Air. And I didn't feel so well when I got home. I said, oh, well, it's just because of the flight, whatever. A couple of days later, I still didn't feel well. I went to the doctor. He examined me and he said, Eleanor, you have pneumonia in both your lungs. I said,
God.
what? And he said, yes. He said, okay, take this prescription for 10 days. So I got the prescription filled. I took it, but guess what? I didn't feel good after 10 days. I went back to him. He said, Eleanor, you still have pneumonia in both your lungs. If this prescription that I'm giving you now, the biggest, gun that we have against these kinds of pneumonia things, then you're going to have to go into the hospital. So Nancy, what did I do when I got home? I called, the pharmacist and said, can I pick up my prescription? But the second thing I did was I called the supplemental AARP and said, I want Plan F. That's what I did. Why? Because we don't have the crystal ball, but if you have enough time, you can go over to the supplemental immediately. You don't have to wait until October to December for a supplemental.
So again, you don't have to wait for that open enrollment.
No, you don't. Unless you're looking at Part D, the prescription drug. You do have to wait for that. Isn't that strange? The supplemental you can get anytime, but your prescription drug plan, only October to December. Okay, and that's where we get into something else now. Epic. Epic. You've heard of Epic, I hope. Epic is a state plan. New York State offers Epic. Is it a drug plan? No, it's a safety net under a drug plan. And it also has one other thing going for it. That's what we call the get out of jail free card. Why do we call it that? Because if you have Epic once a year, you can jump over to the other side and go over and get your Medicare supplemental plan if you want, or change your drug plan once a year and be outside that October to December open enrollment period. And that's how I did it, because I had Epic. And so I jumped over and thank God, the second prescription worked, so I didn't have to go into the hospital. But I was so happy with the original Medicare and the supplement and the Part D. I never looked back, and I haven't yet looked back. And that's why I had the coverage that I needed when I went to California, that visit where I broke my wrist. I was out of the area because when you're on your Medicare Advantage plans, you're going to have those lists of doctors and
Providers, yes.
hospitals, providers that you can go to, and you have to, and if you're out of state, what then? What then? Nothing. You have nothing because they won't cover you. And so unless it's a certain kind of a policy, some of the PPOs, HMO, PPO. HMO just means that list, PPO, a little bit
More liberal.
private providers, a little bit more liberal, but you have to pay more in terms of, deductibles and all of that. But I was able to jump over. And so when I went over to California, that was all covered too. And that was an emergency situation. So you see, sometimes you have the crystal ball, Nancy, but sometimes you don't.
Right, right.
So
Right.
you have to be prepared. But like I say, you don't have to be overly prepared if you're healthy now and you just take one drug or two drugs and you feel like, you're fine. You don't need that much coverage. You don't want to have too much coverage. So you stay on the right-hand side for now. But in the back of your mind, oh, I remember that person with her Boston accent. I forgot to mention that, Nancy. I usually mention that right up front. Now, where is she from? She has such a funny accent. It's Boston. Okay. I remember her. She said something about jumping over to the other side if I really needed to, because I'm sick or I'm going to Florida and I think I need coverage. I better look at these supplemental plans.
Okay, time is moving along here, Eleanor. So I
Yes.
did want to ask a little bit because people confuse quite often Medicare and Medicaid. So
Yes.
could you explain the difference, please?
For Medicaid, you have to have a very, very low income. Okay. And I mean, for this, I'm not very conversant in this because it's a totally different plan, totally different. $1,004 income a month. Think about that. Very low. A couple, $1,320 a month. And your assets are limited to $15,900. Now, what is an asset? That's your cash, the money that you have in the bank. If you have any stocks or anything like that, liquid money, 15,900, not a whole heck of a lot. And you notice we haven't talked about assets for any of the other things on the Medicare side. That's because in New York, they do not count your assets. Even if you're on the Medicare savings program, do they count if you have a house or a car or your money in the bank or your brokerage account? No, they don't. But they certainly do for Medicaid. Medicaid is very limited to the lowest income people in our area or anybody's area. That's how it works. Now, how much are we talking about? I've already said that, but what kind of coverage do you get? Well, if you're over 65 or you have Social Security disability, then what we're talking about is coverage, original Medicare, and then Medicaid picks up the rest. So original Medicare is your primary, and then Medicaid is your secondary. And yes, they do cover dental. So a lot of people want Medicaid just for the dental sometimes, and you can be a little bit over, and then there's a whole other complicated system of how you can have Medicaid with the overage, which they call a spend down. But I'm not going to go into that because believe me, that's very complicated. So in essence, it's very, very different than Medicare.